how do we advocate within a monolithic system that seems hell-bent on stripping us of all agency?
Mhm. Oh, it's not funny. I laugh just because you make such a good point, and it's so darn frustrating. And it feels like the work of many lifetimes to somehow get this darn wonderful, horrible healthcare system to do what it wants to do. I mean, one of the things you realize, I imagine that people go into the health professions, generally speaking, because they really care. And they're filled with love, can be very smart. And they go into great debt, and they sacrifice years of training and let go of other interests, all for the privilege of caring for their fellow human beings. But unfortunately, the system itself in which we labor accidentally, and I do think it's accidental, ends up cutting us off at the knees. And that's how we all burn out, by the way. That's the nature of burnout in the health professions. We don't generally burn out because illness exists. We burn out because we're not able to deliver the care that we are trained and know how to deliver, that we are unnaturally hamstrung. So just to sort of, I mentioned that to kind of get clear on, it's really important to distinguish the providers of healthcare and the limitations you may feel from them from the systems issues. And for the most part, there really are systems issues. The system was just poorly designed, if it ever was designed. It's really duct tape and toothpick together. And if it was ever designed, it was designed around diseases, not people. And that was a fundamental design flaw that set up about 100 years ago or so. So policy issues to kind of change all this, but meanwhile, for your own sanity's sake, and also to get the kind of care that you need, is to remember, I would encourage you to have all sorts of compassion for the people toiling within the healthcare system, even though you may be justly very angry for inadequate care when that person just couldn't even answer a question or didn't look at you in the eye or didn't call you back. For everybody's sake, I would suggest you see that as the problem's really the fault of the system more than of the person. And that'll get you in a position that's accurate, and also prevent you from accidentally shooting the messenger, and even finding some compassion for people trying so hard to labor in the system. That just is a more functional place from which to navigate, and a kinder place, because part of the caregiving burden means you can just get layered up with resentments, and you can become embittered, and that's not a state I think any of us wants to be in. It doesn't serve you. So anyway, those are some distinctions that I think are important. I'm not sure if I answered your question, but there's some thoughts.